Okay.
Okay, and we're recording, and you can get started with your session.
Okay, great. Hello everyone. My name is Sena Mekonnen, and this is my presentation called Bridging Disciplines: Reimagining Healthcare Through Cross-Field Collaboration. So a little bit about me. I'm currently a second-year public health major with an environmental specialization on the pre-medical track at The Ohio State University. I have experience in research in nutritional chemistry and public health. I'm also currently a clinical research coordinator and a medical assistant in a local clinic near my area. And I'm also the co-founder and COO of FaceFrame, a startup integrating biometrics and human-centered design for healthcare for optical solutions, where we're partnering with my university optometry center and local hospitals to get into the hands of patients. And I also have experience in clinical and non-clinical research experience in population health studies. So that's just a little bit about my personal background. Here's some photos that kind of, show that. So just a little headshot of me presenting some of my research at a recent conference I attended at my university, and me doing a community health screening with the local clinic I work for. And I guess a little fun and personal fact about myself is that I also like to rollerblade for fun. And over the next 35 to 45 minutes, I'll be exploring how we can just use fields like clinical medicine, public health, and nutrition, and technology to intersect to solve complex health problems. So the big question, why can't healthcare be solved by one field alone? Well, most health challenges are multifactorial. They integrate a lot of different factors: biology, behavior, environment, and technology all interact. And they're often siloed by research limits and impact as well as scalability. It's kind of sometimes it's kind of hard to kind of focus on these different aspects and solving them as well as scaling them all together. That's why interdisciplinary collaboration enables system level solutions. Also, on top of that, interdisciplinary work integrates knowledge from multiple fields to tackle one big problem. Working in those separate lanes where disciplines operate independently really limits that perspective and impact. For example, clinical work focuses on individual outcomes. Public health looks at populations, and technology focuses on scalability and efficiency. From my personal experience in early research, I've realized that bridging these perspectives and skills
You said
are
that let me eat later, I'm hungry.
are very
I
important.
told you I'm not hungry.
Translating
This is not
population
fair.
level data and clinical interventions,
I'm not
and then
hungry.
designing technology to scale solutions was where I found the most creative opportunities within my own career. So what does interdisciplinary actually mean? As stated before, it's kind of moving beyond lanes, integrating multiple disciplines to address a single problem, as well as connecting different level insights of data at different levels, from population to the individual and clinical level. You can also apply this in biomedical engineering, where you apply engineering concepts to technology and health research to make, healthcare products, as well as informing research questions through diverse perspectives. And the importance of this is that the broad experience often enhance pattern recognition, the ability to see, commonalities across different health problems, and they also often achieve unmet needs that often were looked at before. And also, on top of this, innovation also occurs between these established fields, often offering uh, reliable advancements in continued medicine. So here's some four foundations of health I've explored in my own career as a researcher, as well as a student at Ohio State. Like I said before, my major is environmental public health, so it's very interdisciplinary in terms of how we're taught as students. So, and overall, healthcare outcomes are often determined long before a patient walks into a clinic. And so here are those three pillars that are being explored. Nutrition often influences disease risk, progression, and recovery. Preventive interventions reduce long-term healthcare burdens. Um, some of these include improved diets and also improved nutritional qualities. And oftentimes diet and access to it often interact with social and environmental factors. With public health as a whole, it tracks population level trends and disparities and addresses social determinants of health, such as education, income, and access to care. Preventive strategies to often are used to target communities and not just individuals, often targeting big problems like, like as I mentioned before, access to education, access to diet, access to proper healthcare as a whole. There's also environmental factors, which are um, often not really looked at, uh, including built environments such as air quality, water quality, and climate. And green spaces often affect health for both physical and mental health of people. And often these inequities intersect with really large social disparities that exist within the United States and beyond. Um, And with these, they often amplify risks, and policy and community level interventions are really used here to improve population health as a whole. In my research, looking at these pillars together revealed that patterns are invisible to a single discipline. For instance, neighborhoods with limited access to healthy food, and high populations showed increased preventable diseases, as well as increased environmental factors of lack of air and water quality as a whole, demonstrating how nutrition and environment can sometimes intersect. And interdisciplinary research considers all of these three simultaneously to identify upstream solutions. So, bridging clinical and non-clinical research. Clinical research focuses on patient-centered outcomes, while non-clinical research focuses on mechanisms, population trends, and data sets. Each provide value on its own, but together can often really integrate a complete picture. In my work, I often use clinical insight that didn't align with broader trends and non-clinical findings that didn't account for patient realities. Bridging these gaps strengthened the translational relevance and improved intervention design in a lot of the research I've been able to do. So, as a question for like the audience, what is one example that you've seen in research insights that have failed to translate into real-world practice, whether it's clinical, non-clinical, or both? Um, Feel free to talk about it in the chat or just like speak up. It's okay. Okay, if not, we can move on. Um, with the next slide, it's kind of focusing on technology and engineering as enablers. So, engineering technology has allowed us to turn practical and scalable solutions like biometrics and data science into personalized care. Technology improves accessibility, efficiency, and data-driven insights. Human-centered designs also ensure that solutions are usable and adopted. Um, with this and with my personal experience with FaceFrame in particular, we've had to integrate biometric data, personal research insights from people that we've beta tested with, and clinical observations from the higher ups that we've worked with into a real world tool that can be applied broadly. This has allowed us to ensure that interventions such as ours are effective, scalable, and user friendly. And this is not just applied to tech, but in my experience as someone who's competed in case competitions at my university, through the College of Public Health, a lot of these pillars are really important when identifying reliable interventions for specific problems. So, for example, about this time last year, I worked on a project on increasing cervical cancer screenings within a under-reserved community within Southeast Ohio, which is where I'm from. We had to integrate different data that existed as well as technology and in terms of an accessibility standpoint and further reliable data to kind of prove to the judges that, okay, this is a solution that we can pitch, this is how reliable it is, and so on and so forth. So, interdisciplinary innovation and practice. So, from research to real world solutions, it's important that we identify gaps and intersections of disciplines while applying STEM tools to address healthcare challenges. Incorporating clinical relevance and user needs is important in deciding solutions that are very practical. And at the end of the day, innovation happens at all types of intersections. With FaceFrame, as mentioned before, I've had to combine clinical, public health, and technological insights that have allowed us to identify gaps in our product, as well as implementing solutions that work. And as mentioned before, this is not just applied to tech as a whole, but to other fields as well. The iteration is key. Testing, gathering, and feedback is always important when redefining design of a product and or an intervention in healthcare. So that's why testing ideas in real systems is very important. With this, startups function as live research models for people. Hypotheses are tested through iteration and feedback, and funding validates feasibility impact as well. This is where scalability comes in, where it's often a key measure of success, and how all in all entrepreneurship connects research insights to real world application. Moreover, entrepreneurship functions as that applied research. And with that, I've been able to, as mentioned before, with FaceTrain, been able to test and scale and refine. So, building a niche through breadth. Broad experiences enhance creative and pattern recognition. Intersections reveal unmet needs invisible to a single field. Early in my own career, I was worried my interests would often come off as scattered, but being able to connect them in one long string or gears in this example has given me a unique perspective and skill set that I've been able to apply in clinical and non-clinical settings. And on a broader level, being able to talk about these experiences in medical school interviews is very important. Um, all in all, building a niche while connecting these diverse skills and perspectives allows for a cohesive goal to be achieved more easily, while avoiding the idea of coming off as someone who's just doing a bunch of things. So think of interdisciplinary approaches in research and outside of research, and not as mentioned before in entrepreneurship, as kind of like gears working together in a system that have a very big common goal of kind of moving a system as a whole. So a framework and key outcomes. How to approach crossfield work. So usually you kind of start off with a problem, not necessarily a discipline. Then you identify complementary fields and tools that will allow to target said problem. So for example, as mentioned before, I've worked in um, nutritional chemistry research. So I've also gotten to be exposed to agriculture in the forms of nutritional output in prime crops that are adjusted within the United States. So I've been able to kind of do research on both sides to understand how nutritional pathways um, are in plants and in animals, um, as well as how it is often affecting a lot of the hunger patterns that are across the United States. Also seek integration and not fragmentation. Again, emphasizing the idea of working together rather than working in separate lanes as mentioned before. And on top of that, letting experiences inform each other over time, allowing people to kind of continue to work together and achieve that broader goal of solving said problem. And continuously using the research method of the scientific method, if you will, of testing, refining, and scaling solutions. And what this integration allows is for more comprehensive research questions, as well as often broader translations to patient care and scalable solutions at the end of the day, as well as sustainability in that aspect. So, in summary, a framework that I like to use is start with the problem, identify relevant disciplines that may relate to said problems, integrate research methods from the said problems, and iterate those solutions. Experience in one field can inform another, creating continuous learning loops, and allowing for sustainability over time. So overall, here's a closing and reimagining the future of healthcare and research as a whole. Healthcare challenges are complex, interconnected, and often a lot of system level problems. And I believe that this image kind of shows that. Just shows different pillars in healthcare that whether they focus on individual, global, digital, or just making sure that they're inclusive for all different types of identities and perspectives. Interdisciplinary collaboration is essential for addressing a lot of these challenges, and having those diverse fields in place allow for drives in innovation, equity, and real-world impact. Further breakthroughs will come through for people who can be able to bridge the clinical, the research, the public health, and the technological domains to solving these problems and allowing for sustainability and scalability in solutions. And effective healthcare solutions will require upstream, downstream, and across all systems. So the ultimate goal is to essentially just design interventions that are practical, scalable, equitable, and sustainable through all facets. So in totality, I'd like to close. I want to bring everything together. Modern healthcare challenges are complex and are always interconnected. As mentioned before, nutrition, public health, and environment, as well as clinical care and technology, all intersect to determine outcomes. Interdisciplinary collaboration is essential. The biggest breakthroughs won't come through from experts who stay in their own lanes, but those who work together. From my own experience, I've been able to work with people, as mentioned before, who work in agriculture, who work in medicine, who work in environmental science, who work in material science, to solve all these different issues that are present within medicine and more. Along with that, being able to work on the tech and entrepreneurship side of of medicine has been able to kind of expand my mind into understanding how those bridges need to be made and how they continue to be made to eventually scale broader health solutions. So thinking about the interventions we discussed, designing solutions that are practical, scalable, equitable, and sustainable require considering multiple perspectives from the start. And early exposure to these different disciplines prepares the next generation of innovators to do this, which is something I encourage everyone in this audience to do as well. Thank you. This is time for questions and answers.
Thank you so much for your session, Sena. It truly was an amazing session. I'm pretty sure everyone really enjoyed it. Thank you so much for taking the time out of your very busy schedule to be here with us. If we have any questions, please drop them in the chat for her to answer. If not, we can conclude the session.
Yeah, feel free to ask any questions. If anyone also has any personal questions for me, I can also drop my email or my LinkedIn in the chat. Feel free to connect on there as well. Yeah, I'm always open to hearing any questions as well as feedback, anything of that sort.
Okay, I believe there are no questions, but thank you so much once again for your time, Sena. If you want, the recording of the session will be available with me, and I can email it to you, or I can send you the drive link where we have our previous recordings. And with that being said, thank you so much for being a part of STEM Quest 2.0.
Of course, and thank you.